Thanks for tuning in today. I'm Dr. Nick, the Incrementalist. Join me as I seek out small incremental changes being applied in other industries that we can learn from and that can be applied in healthcare. Can these changes bring immediate value, but also add up to the big improvements and the revolution we need in healthcare? Come along with me to explore the possibilities. My innovative guests from around the globe have used small incremental changes to achieve their moonshot. And today, I'm talking to Dr. Bryan Vartabedian. He's a pediatric gastroenterologist, a physician leader at the Texas Children's Hospital. He's also an author of Looking Out for Number Two. Yes, that's what you think it is. And founder of the now quite widely famous 33 Charts website that I would encourage everybody to take a look at. Great insights and also now memorialized in the National Library of Medicine archives, which is fantastic news. Bryan, thanks for joining me today.
Great to be here, Nick. Thanks for having me.
So I'm excited to talk to a fellow digital explorer in the healthcare space, and I think you have clearly demonstrated a passion around this opportunity for the value that digital health brings. Some of our colleagues have a different view, certainly around the electronic health record or the electronic medical record, and I know you have really some firm views around the value proposition. Tell us a little bit about your experience with the EHR and where you see this going, and perhaps where it's been in the past and how we can improve on that.
Yeah, no, it's a great question, and EHRs are certainly a hot topic. My perspective is unique in that I was raised on paper charts, and now I do all my documentation on Epic through our hospital system, and so it's been a very, very interesting transition for me as a professional. If you look at the broader narrative about EHRs, there's just so much negative press around electronic health records. But yet, when I look at my experience as a clinician prior to electronic documentation, it's really very, very different. I think some of the negative press and the negative views of EHRs are kind of a consequence of where some physicians are at in their career. When I look at the 120 young pediatric residents we have at Texas Children's Hospital, it's really rare, interestingly, that we hear them complaining about how difficult it is to navigate the EHR. They're just so facile with this, and it's easy for them. So some of this is of course, generational. But for me, the EHR really has revolutionized the way I document things, and I've customized it in a way that really, really works for me.
So when you think about that, so that's an interesting statistic that, you have that large number of folks, they're not pushing back. As you think about this, what do you suppose is the factors that contribute to their ease of use? Is it because they're you're not a digital native, but you're advocating this. Did you come at this and find that initially it was difficult, but you adapted? Or is there something that's, just built in because you're a geek?
I am a geek. I did adapt. I kind of can see the value proposition with EHRs. I know that it's early. I know these products need work with their user interface, but like some others, I've kind of viewed technology from an optimistic perspective. I'm a techno optimist, and so when you start with that, you're always looking at the positive in things. Now, when I talked about those people who are really positive about EHRs, those young folks, it's important to understand that these are young physicians who have never held a paper chart. I was really just maybe 5 years ago, we saw the last medical students come through who had never held a manila folder with paper. And so for them, they know nothing else than the navigation of the Epic interface or the Cerner interface or whatever. And so they've also been raised as digital natives. They're just so much more facile with digital interfaces. And so they don't know enough to complain. They don't know enough. They don't know anything different, if that makes any sense.
Yeah. So, but thinking about your experience, so if you're honest with yourself, when you first started using the tool, did it did it become this just eureka moment where you go, no, this is absolutely great. I see the value, and that helped you sort of overcome the difficulty of that change? Or was there more to it?
I think, so to put things sort of in context for me now, I work in a very large hospital system that has a variety of pediatric practices that all operate off Epic. I'm a subspecialist that takes referrals from some 300 pediatricians. So prior to say initiation of Epic, we had Centricity before that. All communication with these remote practices was via postal letter and fax machine. So a patient will come to the office and they will have been seen by one of our Texas Children's Hospital practices 10 miles away. I'd have to wait for a fax for a CBC or liver function studies to come through. And so as a system that's embraced one universal system, and I know not all practices are part of big systems like mine, the benefit of having that connectivity of being able to see everybody's chart in real time was kind of a game changer for me. Yeah, I mean, there are challenges that come with the HR for sure, but those benefits far exceeded what it took for me to really jump on.
So if I was to pull out the thread of that I hear, it was you saw and got immediate value, and that was the, let's call it instantaneous information that was available to you at the point of care when you needed it because of the exchange of that information across the network. Is that a fair summary?
That's absolutely right. Yeah, I could referring doctors could see my notes or my referral, the completion of my consult note almost in real time as soon as I signed it. So for me, that had, I'm big on communication, and so that ability to sort of share information across our system had huge value for me. Now, of course, I still get referrals from other physicians in my area who aren't part of our system or who are on a different EHR system, and so obviously interoperability remains an issue for me. That's not solved quite yet, but just within our large system, I can see the value of having the electronic health record.
So I think that's great, and maybe one of the incremental improvements that people can think about, and maybe the time has passed. I still don't think it has in terms of EHR implementations. Whilst they're widely pervasive, they're not widely accepted, as you outlined earlier on, and bringing people along is important because there's a need for more people to be interacting on these solutions, because the more folks that are there, the more valuable the information and that information exchange. But one of the things that I've heard, and particularly with I actually heard this fairly recently from a group of residents that talked about, it came up in the context of where their location, there's no doctor's office as such, but where were the residents located? They're in the bowels of the hospital and, no windows. But one of the points that somebody made to me that I found very surprising and troubling as well was in the course of, let's say, a 9-hour day, they said they would spend 8 hours easily focusing in that room on the screen, on the EHR, and maybe an hour of actual patient face-to-face time. Does that reflect your experiences?
Absolutely not. And I'll tell you what I do that counters that. When I go into a patient's room, I open up by introducing myself and telling the family that I'm going to spend. So let's go back and say my consult with the young family is about 30 minutes. So when I go into the room, I'll lay out and I'll say, listen, I've got to collect some data here over the first 10 minutes, and I'm going to type furiously like a lady at the airport. And so I collect that, and I tell the family after that, we're going to sit face to face. I have a huge whiteboard in my office, which has actually been revolutionary for me. We can talk about that if you're interested. And so after 10 minutes of the collection of data of my FaceTime with the computer, I'm committed to that family to sort of step away from the computer. And that's kind of how I design my patient visits. And I think that we're not intentional, and we don't think about how we're using these tools and how we have to remain connected with families. We just sort of latch onto the computer and assume that we have to stare at it and click these boxes the whole time, when we have to make that commitment to pull away. And so I think this is really an issue where we as physicians have to make an active decision of where we're going to be, and when we're going to be connected with that interface to the computer, and when we're going to disconnect from the computer and talk to the family face to face or go to the whiteboard. Does that make sense?
Yeah, no, absolutely. And I'm interested to explore that a little bit. When you talk about the whiteboard, that's an interesting concept. Why specifically the whiteboard? Is it something you carry around with you? What's the story there?
No, so the whiteboard is kind of interesting. There are 4 by 5 foot whiteboards that are on the wall, and I outline all my impression and plan with families, and after I've taken history and done an exam, we take to the whiteboard. And what's so interesting is after I've really kind of detailed it all on the whiteboard, the families almost universally pull out their smartphone and take a picture. And so that has real value for them, and they take that away, and it almost serves as an after-visit summary. And what's really interesting, this has happened a couple of times, my narrative impression in my note, as a physician, sometimes when you type a sentence or a differential, it's really hard to get it all down there. But when you have something in a visual form with lists and bullet points and arrows that demonstrates your thinking, it's different. And so families have shown me what I've done on the whiteboard in the prior visit, and what's on the whiteboard sometimes is better than what's in my EHR documentation.
Yeah, I think what you're teasing out there, and it's so there's a couple of points that really stand out to me. One, that's outstanding patient sharing of notes and content, and I'm sure high satisfaction rating. But the other thing that feels like is maybe adapting. It's the flexibility to understand that, what we automated with the EHR was essentially an old process and paper notes, and that's maybe not the most appropriate solution for capturing all this. I'm not advocating getting rid of the EHR. It's just that the modeling of that was based on paper notes, and we've just automated it. And what you're describing is something along the lines of a much more visual capture of that information that I think is both more compelling for the clinician, but also clearly for the patients as well.
Yeah, and I started it from a book called Sketch Notes. I don't know if you've gone to these meetings and you see the people down front on those on the easel with the paper, and they're making those arrows and they're summarizing a keynote with these bullets and arrows and little figures. And that's I have a little bit of an artistic flair, but I've taught other doctors to do this, and it has real value. But to your point, you're right. It's a different kind of visual documentation, which is very useful, I think, for some families. We're seeing this with the rise of visual abstracts. Andrew Ibrahim from the University of Michigan has popularized this concept of visual abstracts, which is taking research abstracts, putting them into simple visuals. You've probably seen these on Twitter, and journals are even picking up on this. And so there is a movement for better design with education and documentation. And to your point, you're right. The electronic medical record is kind of like a digital paper chart, right?
I think, yeah, the only sad thing is, I don't know, but certainly in my particular instance, my artistic capabilities can be essentially summarized on a very, very small piece of paper, sadly. So I've actually tried hard to sort of improve it. I've bought books and, drawing on the right side of the brain and all of this, and I've just never been very good. And it's distressing to me because I look at that and think, wow, that's a great way of capturing. I've just not managed. So maybe some tools that can help with that might be useful. So for those of you tuning in today, I'm Dr. Nick, the Incrementalist, and I'm delighted to be joined by Dr. Bryan Vartabedian, the pediatric gastroenterologist from the Texas Children and founder of 33 Charts. So Bryan, you talked a little bit about the current EHR. I want to get your thoughts on where you see that going. And one of the compelling visions I've seen, I think, if I was to credit the original author, and I don't know if he is, but that's where I first heard it, was John Halamka talking about the sort of wiki record or the Facebook record, and I don't mean that in terms of the pervasiveness of the Facebook, but more of the news feed, where you assemble this information and it continues to grow and develop. Any thoughts on where that might go, particularly as you think about your whiteboard solution, where that might be incorporated in?
Yeah, no, that's this thought about the future of the EHR is kind of interesting. I think still to this day, despite electronic or paper, we see the medical record as a place to record things that once happened or things that very recently happened. Going forward, I would imagine that we're going to see the EHR evolve as more of a real-time tool that's going to capture patient data from wearables and other things in perhaps a dashboard type of format where we could really get a sense of what's happening in real time with families. I think the company is Health Loop that follows patients post-op from hip surgeries and whatnot, and there's data fed back into the Health Loop interface that allows doctors and surgeons and nurses to see post-op what a patient's doing. So rather than being a historical document, I think going forward we're going to see the EHR evolve as more of a dynamic body of information rather than historical. Does that make sense?
Yeah, no, I agree 100%, and I think the challenge is sort of moving from where we are now, which is this sort of static store of information, and then presenting it. And the reality is, it's a programming problem. It's not, the data's there. What we tend to do is to sort of present it more in this transactional form, and the reality is that a moving vibrant document of your medical history that adapts depending on the information, but can always be recreated at a point in time. I think there's a fear that, oh my goodness, I made a decision on, this information, but it changed, and you're changing what you show me. It's about this sort of fear of, I made a valid decision, and I don't think this changes that. You can still recreate it. I think we just have to be a little bit more adept in the presentation layer of all of this. So I think
Nick, can I ask you a question just about
absolutely
some of these legacy systems that we operate on, and what I was just talking about really represents really some level of innovation in electronic health records. I mean, do you think that these legacy systems kind of hold us back from making these changes that need to happen?
So I don't think they have to. I think they potentially do at this point, because we sort of vest so much focus and attention on the use of them, the implementation of them. The reality is, with the new sort of models of programming, with agile programming, modular styles and approaches, where you can have entirely different presentation layers and how they access information. If we could make that interoperable securely, importantly, I think the reality is that information is still relevant. It just needs to be, in my mind, presented in a much more agile form that is visually enhanced to adapt to the new age of this digital medicine world that we live in.
Yeah, it's remarkable when I look at a complete blood count that comes in from a patient, and it's in this, what it's like. It's in this spreadsheet like presentation. There are so many new ways, and there are some young companies doing remarkable work with data visualization that just something as simple as a CBC, the way it presents to me, it really needs to change.
Absolutely. I'm a big fan of Edward Tufte, if you don't know him,
Yes,
and his sort of capacity of presenting data and the impact that has. So we're running out of time, unfortunately, but I did want to at least get your thoughts around. I know social media, you're a huge active participant, a huge advocate. I see lots of pushback and negativity. I don't have time. What's the relevance of this? What are your thoughts around that? And how could our colleagues, clinicians, and even patients, how can we navigate this new sort of complex future of healthcare and the way that we've sort of moved into this social media space of always on and always engaged?
Yeah, I think it's symptomatic of the fact that, certainly as physicians, we're no longer restricted to our immediate in real life spaces. Beginning with the internet a decade, 15 years ago, we are now part of a network presence. And so our public presence, as I like to call it, collectively, all the things that we do beyond our immediate space, is part of a new responsibility that physicians have. And so much like Wendy Sue Swanson, believe that physicians have some moral obligation to be out as part of the public conversation, especially with regard to health information and things like that. Professionally, this is where people find us. The online space is where the world finds us, and even where patients search for us to begin with. So it is challenging because we as physicians have absolutely no training in how to use any of these tools. Very few medical schools are even training young medical students how to navigate this space. And so there is a lot of work that needs to be done. One of the best things that I always advise my young colleagues who want to get into either social media or blogging or podcasting like this is to find someone in their world, in their specialty, who's doing what they want to do. Find some great role models and see what they've done. And oftentimes that's a great way to get started and following the example of a good public physician.
Yeah, I agree with you. I think, the point I make repeatedly is that train has left the station and you're either looking at it departing or you're on it and participating. And, the lack of voice is hurting. We abdicate responsibility for addressing some of the misinformation, certainly, that exists and, respected voices that participate. And I know there's some resistance to it. How do you think, particularly for clinicians, so both you and Wendy, do a great job of sort of navigating that. You obviously include it in your day-to-day activities. I'm assuming that's the case. You don't have a team of people doing all of the content for you. So how do you do that? How does somebody start through that process? What would you advise a clinician who's not even there, but feels like this is a good idea? What should they do? What first step could they take?
Yeah. Well, obviously starting with looking at what someone you respect is actually doing, who's already out there doing this, is a great place to start. But choosing your platforms, we have this sort of embarrassment of riches with all these social channels and applications and ways to communicate that I think it's important to really restrict where you spend your time and what you listen to. So choosing just to build out your LinkedIn profile, perhaps, and to develop a presence on Twitter might be a good basic way to start. And I'm drilling down on Twitter, limiting the number of people you follow to really, really smart people so that you have a really strong human signal is great so that you don't get overwhelmed, because I think that feeling of being overwhelmed and getting too much information is a recurrent problem with new doctors when they get into this.
Yeah, so fantastic. So just to sort of close out, as you think about this quest into the digital health environment that clinicians are emerging into, certainly the new clinicians, some of the folks that have been in the practice of medicine for a long time, if you have one small piece of guidance to help them survive this, what would it be and why?
Well, I think, Nick, that this is probably, in the last 300 years, one of the most interesting times to be in medicine. And we as physicians, rather than feeling like we're getting pulled along by all this technology, which is, I think, a lot of doctors feel that way, we probably need to understand that we have agency and we can really play a role in how the future happens. They say that rather than predicting the future, we should create it. And we need to be more active participants in shaping how some of these products are developed. And so we really should be excited about this, get out there, get out into the infosphere and see what's being written and engage and listen to shows like this. And that's a great place to start.
I love that. I couldn't agree more. I think it is the most exciting time to be alive. And I'm sure in, 100 years' time it will be too, but it certainly feels like it's very special, and I'm very excited to be around and delighted to have been joined by my guest today, Dr. Bryan Vartabedian. Thank you for joining me, Bryan. It's been a great conversation.
Thank you, Nick.
So thanks for joining me today. Do you have any better ideas, or have you found a small incremental change that has brought about a big improvement in your world? Let's continue the conversation on our hashtag the Incrementalist, or share it with me at Dr. Nick1 on Twitter. You can find more information about the show on our program page at healthcarenowradio.com.